then we'll have to see if anybody wants to be added as a sponsor, and they'll go out as individual, with individual sponsors, excuse me, but without committee approval. So I can't even call the meeting to, are we good to go? Okay. Can't even call the meeting to order because we do not have a quorum, so we'll start with Dr. Giordano, if you want to come up and present.
Sure.
Thank you.
Thank you very much. You know, Cindy Hoffman.
Oh, yes, Cindy, how are you tonight? So, just for the record, for folks, what we're going to do is, this isn't an official meeting, so I'm not going to ask for minutes to be approved. 2, 3, and 4 were being tabled at the request of the sponsor, so we're going to move right into what would have been the normal agenda under current business. Number 5, amending the 2025 Department of Mental Health budget, Hospitality House.
Thank you, Mr. Chairman. Each year I come before you with the pass-through contracts to our substance abuse agencies. Hospitality House is one of them. In mid-year, sometimes the state agency, in this case Oasis, elects to add money to the agencies for various reasons. In this case, we're asking to amend the 2025 budget in the amount of $109,353. This is 100% Oasis state funding to go to Hospitality House for capital project that is currently underway. They're expanding their residential treatment program on Central Avenue, and this money the state is awarding them.
Thank you, Doctor. Do we have any questions from the members that are here?
Just one question, Chairman.
Go ahead, Patty.
Dr. Mike, how are you?
Hi, good, thank you.
When you say they're expanding their place in Central, but just there, they're not relocating?
Correct.
Okay.
They're, it's a 45-bed
Right,
residence for 18 above males,
right.
and they've just been breaking at the seams, so they're building an addition in their parking lot, and that'll allow them to add a certain number of beds, and but they're not going anywhere else.
They'll stay in the same one.
On the same footprint.
Thank you.
They said, I think they said up to 72, right?
So it's interesting. The capacity with the new is supposed to be up to 72.
Are they still only going to take males? Even
Yes.
at that?
Yes, they historically they were co-ed,
Right.
and it didn't work out very well.
I understand.
Just saying.
Any other questions? Okay, at this time, I'd like to ask that I be added as a sponsor to this. Would any members of the Health Committee like to be added as a sponsor?
Should we add it, please, then?
All members present, Peston, Lockhart, and Mr. Miller.
Thank you.
Thank you. Okay, moving on to number 6, authorizing agreement with Albany City Police Department regarding the street psychiatry pilot program and amending the 2025 Department of Mental Health budget.
Yes, thank you very much. So this should trigger a memory for you all. 2 months ago, the first part of the street psychiatry initiative was presented to you, and with resolution 123, there were improvement initiative funds dedicated to this project, and we're coming to you today to actually ask permission to do 2 things. One is to amend the budget with $250,000 from the state surge funding through the Albany Police Department to add on to this street psychiatry program, and as well to make some budget adjustments so that we can reallocate some existing lines in the mental health department budget to begin to stand this program up.
Thank you, Doctor. Do you have any, Patty, question?
The 71% local, is that referring to the police department's share?
Of the funding?
Yeah,
Yes.
okay.
Yes.
And also, we've been seeing a lot coming through for the psychiatric mobile unit and so forth.
Yes.
Can you tell us a little bit how it's doing, how things are going?
Which program are you talking about? Because we're not up and running yet with street psychiatry.
Oh, I got you, okay.
We are doing, I mean, we have changed our kind of focus.
The street psychiatry?
The street psychiatry
Okay.
program is what, this is another initiative that we're hoping will complement some of our other outreach type programs. Our motor program, our mobile crisis team, those are already pushing out.
Okay.
This is really a reflection, this is something we've been envisioning for many years, and I think it addresses the fact that so many of the people who we're encountering are not able to branch of office-based services, and we really need to bring it to them with the hope of engaging them and reducing homelessness and dealing with crisis in the community. So this is really a new initiative, and we really haven't seen anything like this.
No, I was aware of that, but are we out there on the streets doing it?
Not yet.
Not yet.
Not for
Haven't
this
started.
program, I think you might be referencing some of the street-based case management programs that are out there, including CARES, which the county has a role in,
Right.
and SOS. So there are programs out there doing some street outreach and case
Yeah.
management. What's different about this one is it's an actual treatment
Right.
program that Ralph's carrying.
That's why I was curious to know, when do we anticipate actually being out on the streets?
Well, if you approve our request, that'll be the first step, and we would like to start filling these positions, and it'll be soon. I mean, we could stand this up. It's a mobile team, and so we don't need capital money or to build a building, or, so it's kind of vague. As soon as possible is our hope. The need is there. We've been thinking about this for a long time. We've been able to put together 2 funding opportunities, and we're going to make this into a thing.
Okay, good. Hopefully by the end of the summer we'll be.
I would like to think so, yes, for sure.
Okay, thank you, Mr. Chairman.
Thank you, Ms. Lockhart. Any other questions from the members present? Hearing none, I'd like to be added as a sponsor to this. Would any members of the Health Committee like to be added as a sponsor? Please add Ms. Lockhart, Mr. Pesta, and Mr. Miller. Thank you, Doctor. I think you're all done for the night.
We are, and we really appreciate it.
Thank you,
Thank you
Ms.
very
Lockhart.
much.
You're welcome.
Up next is Commissioner Miller. How are you tonight?
Good evening.
Well, Mr. Moore, too. How are you doing, Ransom? Good evening. You probably heard, we no quorum, we'll move things out as individual members, so move right on to number 7 for the Health Department, authorizing an agreement with the Cornell Cooperative Extension for the lead abatement training.
Yes, thank you. We request approval to enter into a contract with Cornell Cooperative Extension for $87,200 to provide lead abatement courses to landlords and contractors, etc. The courses will it varies. The supervisor's course is a little bit longer than the actual course that will be offered to individuals who will be doing the work. It will be funded by our lead rental registry, and it's to ensure that folks who are doing the renovations are doing it safely, not only for themselves, but the residents that reside in those apartments.
Thank you. Any questions from the committee or members that are present?
Just a comment. When they're doing any of these renovations, when people are doing renovations, redoing houses, and they run into places with lead, this is great to have this for them. Is there what's the mechanism to make sure they're doing it? You know, then they just go and do it on their own and nobody knows kind of thing?
Yeah, no, our department is involved, so a plan is drafted, reviewed with us. They then go in and do the work, and then before children or pregnant women are allowed to go back into the place, depending upon the extent of the work, we have to go in and okay. And
But
it's
as
been
long as they let you know though, so in other words, somebody buys a house and decides to renovate it, there's nothing to necessarily stop them?
Unfortunately.
Okay, so this is an availability issue versus a you must issue,
That's
even though
right.
they really must, but yeah.
That's
Okay.
exactly right. With the new rental registry, which will begin hopefully in November 2nd, folks will be required in a multi-dwelling unit to register.
Good.
Now, we do know of all of the multiple units, but sometimes there are people that are kind of under the radar, but we will go out and inspect those residents' apartments as well.
I forgot about the registry too, so yeah, that's perfect, thank you.
Mr. Miller, do we have any other questions? Hearing none, please add me as a sponsor. Would any members of the committee like to be added as a sponsor? Ms. Lockhart, Mr. Pester, and Mr. Miller. All right, moving on to number 8, amending resolution number 252 for 2022 regarding the rabies grant program.
We are here requesting approval to enter into a contract with the State Department of Health for our rabies grant program. It will basically extend the grant funds that we routinely receive for another 2 years. And it will be in the amount of $98,144 to continue to provide rabies education, run our rabies clinics for the animals, and do treatment of post-exposure prophylactic treatment for humans.
Thank you. Rabies clinic, is that the actual testing done that?
Yeah, so we actually have a vaccination clinic. We contract with Hudson Mohawk, and we vaccinate animals. And then we also, if someone's exposed to what is believed to be a rabid animal, they come down to the health department and we provide prophylactic medications to them.
Okay. The testing is, so if someone brings an animal to the New York State Department of Health lab on 155, is that covered by the state, or is that?
Typically, although it depends upon the extent of the work they have to do, and then they will charge us. So that helps with that too.
Do you have any questions? Ms.
I
Lockhart?
do- Probably a stupid question, but if I was exposed to an animal that believed had rabies, is there a test to know whether I got it or not? Or do you just have to treat it anyway?
We would treat it, so you would go through a series of injections. It's not the most
But
pleasant thing.
there's no test to know.
No, it typically happens over time, and it's very important to just get treated right away and not wait for symptoms of rabies, because most folks die.
Yeah. Okay, thank you.
Ms. Lockhart, any other questions from?
Don't go outside,
Stay
man.
away from that.
Any other questions from the
I
committee?
don't want to.
Another question?
I don't know.
Oh, okay.
I'll sponsor it, I don't want rabies.
Okay. We have I'd like to be added as a sponsor, Ms. Lockhart, Mr. Peston, Mr. Miller. Okay, number 9, amending the 2025 Albany County budget, regional expansion of Albany County Healthcare Cooperative. Thank you, Ms. Miller. Mr. Moore. Evening, David.
Good evening, how's it going? Mr. Beams here will be taking kind of point on here, but I'll jump in if we need anything.
Sure. Good evening, Chairman and members of the committee. Thank you for the opportunity to speak with you today. I'm here to respectfully request your support for 2 resolutions critical to the successful formation of the regional expansion of Albany County Healthcare Cooperative, or also known as REACH Co-op. We've referred to this in the past as the Healthcare Consortium. We're in the final stages of completing our application to the New York State Department of Financial Services for the formation of the REACH Co-op. These 2 resolutions represent the essential final steps in the process and require your authorization. First, we are seeking approval to transfer $3 million from the county's fund balance to a newly created human resources budget line. This funding will serve as a reserve requirement for the REACH Co-op, serve as the reserve requirement for the REACH Co-op in accordance with Article 47 New York State Insurance Law. The state mandates that these reserves are established prior to us submitting the application. I'd like to take questions on the first one.
Thank you. I think this is another finance, do I see? Okay. No worries. Do we have any questions from the committee?
I didn't have any questions. I had a couple of documents I couldn't download them.
Okay.
They weren't showing up, so maybe we can see those later, but it's basically if I recall, this is just a straight consortium, healthcare services with, how many?
We're 8 partners now.
Huh?
We have 8 partners?
8, okay,
Yeah.
thank you. 8, they're all counties, right?
No, I'm sorry. The majority of them are actually libraries,
Oh, okay.
and we have 2 villages. Or
Okay.
All in the county.
all in the county, excuse me, yes.
Oh, I'm sorry, but it's with Tompkins County though?
No, it's modeled after Tompkins County.
Oh, okay, gotcha. Because that, in our thing, it shows the County of Tompkins one, so I thought that's where we were joining.
Yeah, no, they were
Consortium
kind of
with
the,
them.
they
So
were
this
the
is our
first
own
in the state,
consortium.
yeah.
Yes.
Albany County-based
Albany County,
consortium
yeah.
with whoever wanted to join in. I guess,
Yes.
library. All right, that was confusing here. Great idea.
Good. Any other questions from the members that are present? Okay, at this time, please add me as a sponsor to this as well. And would any members that are present like to be added as a sponsor? Mr. Miller, Mr. Peston, and you're good, Patty?
I'll go on.
Is that?
Are you
Go on.
Would you like to go on?
Sure,
Okay,
yeah.
thank you.
Thank you very much.
Okay.
All right, Mr. Chairman. Second, we request an amendment to Resolution 164 of 1993 to expand the defense and indemnification coverage for county officers and employees. Specifically, this would ensure coverage for activities related to their roles in the development and administration of the healthcare co-op. This recommendation comes directly from our consultants who are guiding us through this regulatory process. And just in closing, both resolutions are vital to advancing our goal of establishing a sustainable community-centered healthcare option for Albany County employees and their families and other residents and employees of other governmental entities within Albany County. We appreciate your thoughtful consideration and continued support in this matter.
Thank you. Do we have Mr. Miller?
Yeah, I do. So, just help me understand this a little bit better. Again, totally supportive of all this, just want to understand what I'm saying yes to here. So when you have the co-op, they're gonna be employees of the consortium? Or these are county employees that are just doing something different they were covering them? Why is that, why do we need this?
Any county employee working on the consortium, it was recommended that we do this resolution so that if it's, just to have that extra kind of coverage. I'm not a lawyer, but
Yeah.
the lawyers recommend.
Well, I didn't know why they wouldn't still, if they're still county employees, why wouldn't they still be under the regular indemnification? Is
That's a
it
great
because of
question.
duties outside? I'm guessing, I'll help you then, I think maybe. I'm guessing that it's duties that are not normally their duties, is
Yes,
that really what it
so
is?
my understanding is, the way it's originally phrased is doing day-to-day duties of county, government.
Right,
This being, a new responsibility wouldn't have been contemplated back in 93 when this was passed.
okay,
They're just rolling it into government.
okay.
Right, that's correct.
And maybe not related to this, I'm not sure, but does this, when they cover, let's say when you have a consortium, each group that's involved usually has a representative on that board,
Yes,
so to speak.
yep.
So let's say there's a library person that's a representative to help the consortium, would they then be covered under this too, or no?
Yeah. So we advised at the last planning meeting that we had last Wednesday to the Reach Co-op members that they, and I believe if we haven't, we will, give them a model resolution so that they can pass that within their own
In their order,
organizations.
Perfect, thank you.
Thank you, Mr. Miller. Do we have any other questions from the committee? Hearing none, I'd like to be added as a sponsor and move it out. We have Ms. Lockhart, Mr. Best, and Mr. Miller, and names as sponsors as well. Thank you, Mr. Beams, and Mr. Riley, have a good evening.
Thank you, Mr.
Thank you
Chairman.
very much.
Can I ask for a motion to adjourn, because we have.
Can I make a motion not to adjourn? To not,
I think it's better when we don't have a quorum, those other people, that's trouble.